Yay. We already have people in there. Welcome. Welcome, everyone. We are gonna get started in about 2 minutes. Just to let folks log on. We're excited you're here. And we're gonna get started in just a couple of minutes, so. I'm gonna repeat also what I just said if you just heard that. Welcome in, everybody. We are gonna get started in just a minute. We're gonna allow folks to get into the webinar, and then we will get started. Thanks, Monique, for putting that in the chat. Give folks a few more seconds. Okay, let's get started. Welcome, everyone. Welcome into the space. We are going to get started. For folks who are just coming in, welcome. I'm sure more folks will be joining us in a couple minutes. We have a lot of content today, so want to be respectful of everyone's time and get through content and make sure we have time for questions. My name is Raven Jones. I'm the director of peer-to-peer youth mental health at the Children's Partnership, and I'll tell you a little bit more about that in a second. We're excited to have you here with us today to preview the peer-to-peer high school pilot demonstration, which is administered by the Children's Partnership in partnership with the California Department of Healthcare Services. So before we get started, I do have a few reminders for everyone that are hopefully helpful. So first, this webinar is being recorded. So if you have a colleague who couldn't jump on, as long as folks are registered, you will get the recording of this webinar after the webinar has concluded. So all the information that you hear, if you need to hear it back, you'll be able to do that. We do have a specific Q&A button. So there will be a question and answer portion at the end of our presentation. So you can drop any questions that you have that you want to be answered during that question and answer portion in the Q&A box. It's next to the chat box. And we will answer your questions during the Q&A portion of the webinar. So if I'm talking or any of us are talking throughout the webinar and you have a question that comes up, just stick it in there and we will get to it. If you need closed captioning, you can click the live transcript button in the Zoom toolbar, and then closed captioning will pop on. And then the last thing is just we are going to have the chat on for the first portion of the webinar. Please feel free to use it, especially to introduce yourself. Would love to know what schools, what school districts, what community-based organizations are represented here. Would love to see who's here in the chat. But please make sure to just watch your language and be mindful of your behavior, because we want to ensure that this is a safe and welcoming environment for everybody. So those are the those are the norms. There's also someone who's monitoring the Q&A. So if you have like a urgent question that's maybe like text specific or something like that, my colleague Jen, who you see up here, it will be monitoring the Q&A. Okay.
We actually have one quick question already. The chat is currently disabled, so people aren't able to introduce themselves. If we could enable it so they could introduce themselves.
Awesome. Thank you. Monique, will you work on that, please? And thank you. Thanks for whoever let us know that. Okay, cool. Let's move on. So, introduction. So yes, would love to know who's in the room with us today. Would love to know who all of you are. Like I said, Raven Jones, Director of Peer-to-Peer Youth Mental Health at the Children's Partnership. And I have my colleague Kelly Davis here, Vice President Peer and Youth Advocacy at Mental Health America. And then my colleague Jen Ford, who's our Mental Health Policy Associate and actually just left the classroom after 8 years to join us at the Children's Partnership. So we're really lucky to have both Jen and Kelly on the webinar today to talk to us and to help us through the webinar, answer any questions that we have. And you'll get to meet Kelly and get to know a little bit more about Kelly in a minute. Cool to see all of the different programs in high schools and cities represented across California. That makes me so happy to see folks from Oakland to LAUSD. Makes me super, super happy to see that. Okay, so what are we gonna cover today in this webinar really quickly so you know how you're gonna be spending your time. So gonna tell you just a little bit about the Children's Partnership if you're unfamiliar with the Children's Partnership. We're gonna do a very high level overview of what peer-to-peer support is, why it is so pertinent, and why we are investing in it. And then we're going to get into the nuts and bolts of the peer-to-peer high school pilot demonstration and application, which is, I think, why you are all here. So we're going to go over sort of the big picture of the pilot demonstration and the application, and then we're going to answer any questions that you have. Okay, so let's move to the Children's Partnership. Okay, so the Children's Partnership is the administrator of the peer-to-peer youth mental health high school pilot demonstration. We are the state's leading voice for children's health equity. We build power with those most affected by policy decisions, specifically decisions that are related to or impacting children. We envision a world where all children, regardless of race, ethnicity, or place of birth, have the resources that they need to thrive. And we do our work through advocating through legislation, research, community education. Our portfolio of work spans from healthcare to housing to mental health to early childhood education, and more. And it's most important to note that our work is in partnership with community-based organizations, and community members themselves. So that's a little bit about the Children's Partnership. We are a policy advocacy organization, and we are the administrators of this pilot demonstration grant. So if you're not familiar with the Children's Partnership, I encourage you to visit our website, read about the work that we're doing, or reach out to any one of us on the team, especially if there's an issue area that you're specifically interested in. You can always reach out to us, and we're happy to be connected to you, to learn more about what you're doing in your community and how we can support you. Okay, so that's the children's partnership. So I'm gonna pass it over now to my colleague Kelly, and she's gonna do an overview of peer support. So Kelly, would love also for you to introduce yourself, introduce your work, and talk a little bit about how you come to this work. And
Yeah. Good.
I'll move the slides for you.
Perfect. I was gonna ask. Thank you so much. I am so excited to be here. California often leads in a lot of things, and I think the growing interest in youth peer support has been really amazing. So I'll talk a little bit about how I come to this work, what I do. So I work for Mental Health America, national mental health advocacy organization, and go through some of the things that we have found from and heard from young people, as well as some of the things we've learned from working on peer support for a long time. So just, I guess, a little bit about my story. I am a person with lived experience. Like many people with lived experience, I felt like there was something different about how I was perceiving the world compared to my peers from an early age. I had my first suicide attempt when I was 10 and spent my middle school, high school, college years in all sorts of levels of mental health services. Got to college because of my mental health struggles, really was on the verge of failing out, losing financial aid, was diagnosed with bipolar disorder. And the thing that changed my life the most was getting access to peer support. I'd never really, it often felt like I had the secret life of services, couldn't tell anybody that I was struggling, really isolating, and kind of, even when I had resources, it was like resources were done to me. It didn't really feel like what I wanted or what I enjoyed was ever considered. And I think peer support and the values of peer support really put people at the center. So I've been working started as an activist as a college student, and then have been at Mental Health America for the last 8 years, focusing primarily on youth and young adult leadership, as well as advancing peer support. And that is the full spectrum of peer programs and advocacy. And I'll go a little bit over that, but peer-to-peer models, right? Just as a caveat, so I have, been excited to see the advances, but I think it's always really important for us to say peer support is not a replacement for any other kind of clinical services, right? It is a distinct type of support. It really allows people with shared experiences, shared identities to come together and support one another in the ways that matter to them, from a space of mutuality, of I relate to you, talking to you makes me feel less alone and more connected. Next slide. So I'll get to a point, right? Part of why I think youth peer support, I'll go over why, what young people want, but I also think there's really a growing conversation around prevention and changing communities, right? So when we're talking about expanding the mental health workforce, the idea that we can very quickly and sustainably build out, a bunch of clinicians who take years and years to go through school, doesn't meet the needs of the moment, but it also really doesn't have as much of an impact on the kind of community in the way that young people can, if we're changing values and norms and conversations. So what we have found over the years is young people really want peer support. That slide is we did a survey in 2020 about 2014 to 24-year-olds, and interestingly for us, mental health absences and of course access to mental health supports were at the top of that list. But really integrating resources and education into the spaces where young people are already spending their time, right? So whether that is in school, whether that is clubs and activities attached to school, young people really don't want to kind of, and often don't have the kind of luxury or access to build their lives around these external systems, as opposed to kind of coming to them and meeting them where they are, and also really want support from their peers. We've also found that through Mental Health America's online mental health screening program. So our screening program started in 2014. I think right now we're over 16 million people have used it, primarily under age 24, screening moderate to severe for depression, anxiety, substance use. And what we found was that a lot of young people weren't interested in getting connected to support. What they really wanted was information, the ability to experiment themselves, and connection to other people like them. So, for young people, they're kind of in this place of exploring and finding out how they can help themselves. The Born This Way Foundation also did some research on peer support and the interest in peer support, particularly in higher education. And they found that first, peer-to-peer models were in extremely high demand. And this was particularly for BIPOC and LGBT youth who often do not see themselves reflected in the traditional mental health provider workforce. So don't necessarily have supports that really understand them and what it is like to navigate their experiences. And then finally, young people, where they are in their lives, they're figuring things out, they're figuring where they fit in, and often don't really resonate with the medical model, and are really interested in kind of defining themselves in mental health outside of systems. And, clinical language, clinical services don't resonate as well as more non-clinical kind of approaches that would come from the peer support world. Next slide. So just to think about why this matters particularly to young people, right? Young people, when you're in middle school, high school, college, right? Your connection and your understanding of how you fit into your community and compared to the other people around you is one of your biggest priorities, right? And young people, when they're struggling, the first thing they do is not, often not kind of reach out for therapy, reach out to an adult, but they talk to their friends, right? So they're already having these conversations and reaching out for support. And many young people, they trust one another, but they don't necessarily feel equipped to have these conversations, even though they might be the first people, right? When they have these deep relationships or connections or spending a lot of time with their friends or other people in their classroom, even if they notice, they don't necessarily know what to do. I think peer-to-peer models can also really change culture, right? If you're thinking about not only do I have individual connections, but belonging is really, really important, especially for high school students. So kind of creating environments where people can feel like they belong. And then I think finally, it can't be, I think, overstated how different the world is and how different it is to be a young person now versus any time before. So really being able to connect, and not dismiss young people for kind of the conflict and dynamics that are specific to Snapchat, right? Things that older generations just don't have context for. And, we've talked about that before, but I think now, especially after the pandemic, really, it is very different to be a young person today. Next slide. And yeah, I thought there was one missing. But I'm enjoying the illustrations, and also right, agency. So the being able to do things for yourself and experiment and learn things is also really important when you're at that age. We have evidence to support peer support. So this is from a document called Values of Peers from the Substance Abuse and Mental Health Services Administration. We know that peer support increases hope, empowerment, agency, engagement, social connectedness, right? All of these things that are super important when you're a young person and your life is really about who am I, where do I fit, what is my future, while also reducing things like depression, substance use, and hospitalization. And can also really we talk about a lot with young people not being fully engaged in more formal services, and peer support has also been a really great is a really great tool and opportunity for folks to kind of get from struggling to feeling more empowered to engage in services if they want to. Next slide. And what I think is, go back. Thank you. What I think is really important, right? So peer support is a relational term. Sometimes if you spend a lot of your time in the mental health system, it's used as a way to, it's used as kind of a euphemism or stand-in for someone with mental health systems experience. But I think when you're talking about young people, peer is not necessarily about any systems involvement or mental health experience, but just young person to young person. So I think it's really, really important to also think about how we can build programs around who young people identify as their peers, and that might be a lot of different parts of their identity. But a lot of conversations about youth peer support, I found that people are often talking about different things and using that term interchangeably. So typically they are, when people are saying peer support, and I think it's just really important to be specific about what you're talking about. Some, when they're saying use peer-to-peer or peer support, they're talking about gatekeeper training. So things like mental health first aid, where you're equipping young people with certain language and the ability to listen to their peers and maybe refer them to resources if you feel that that is the appropriate thing to do. So you have this, training all young people with basic skills to listen. Then you have mental health education and support programs. So these are more like student clubs, text-based support programs, different ways for young people to learn mental health skills, do more mental health education, and also receive support. So that could be from more formal peer support groups, but also things like one of the examples that we often use, we work with a student athlete who created a student mental health and sports club. So they were talking about and using the language of sport as opposed to just this is a mental health support group, but this is our community and we're integrating mental health language in a way that resonates with us. And then finally, formal peer support specialists, right? So folks who, sometimes there's peer support specialists in schools, but this would be more certified peer specialists helping people do more navigation and more systems involved than kind of a more general peer-to-peer support group or program. Next slide. And all that to say, and then I'll turn it back over, and I'm so excited to hear about what's going to be happening with the new grant program. But I think it's just important to, in these conversations, as conversations are advancing around youth peer support, I know when I first started, a lot of the conversation around youth peer support were really focused on liability and fear and people not being sure, what to do or how to do it. I think we're growing, especially in being able to have models and increasing amounts of research to really show how you can do this work effectively. But I also think that it's just really important to make sure, right, in schools, we're often talking about like 3 tiers, right? So we're making sure that all young people have these basic skills to support their peers. For young people who want these more formal clubs or opportunities to connect, whether that is a peer-to-peer support club in their school, whether it is a healing circle, whether that's a text line, a call line, a mental health and sports or an arts club, going where young people spend their time, letting them define what peer means to them beyond just being another young person, and equipping them with the skills and resources to support one another. And then I know California has been a leader in peer support and the peer specialist workforce. So making sure that we're also integrating peer support specialists where in the systems and spaces where young people are spending their time, right? So more drop-in centers, community mental health, and other youth serving systems like juvenile justice. And I'm at my time, so that illustration is from a paper that is listed on, that's the bottom all the way to the left, but we can share in the chat for folks who are interested in learning a little bit more, you know, learning a little bit more about peer support, some additional resources for you to check out. And then I'll turn it back over to you, Amy.
Thanks, Kelly. We'll also share all the slides with folks as well. So if there is specific information that you want to review again that Kelly just went over, you'll have that information as well. And these are just additional resources. These resources also, if you're planning to apply for the grant opportunity, will appear in the application, and you can also find them on our website. But thank you, Kelly, so much for sharing your personal story and your personal relationship to mental health and to peer supports, and just sharing about all of the amazing work that you do in this space. Okay, y'all. So I'm very excited to preview for you the peer-to-peer youth mental health high school pilot demonstration grant opportunity. I just want to say that the next several slides will have a lot of content. So again, drop your questions in the Q&A, and we'll be happy to answer or reiterate anything that we've covered. But let's get into it. So what is the high school peer-to-peer pilot demonstration? This is a school-based, youth-driven mental health grant opportunity. As included in the California 2022-23 state budget, this grant is administering a historic investment in youth mental health and well-being through an $8 million effort to support 8 selected high schools across California. And so, want to get even clearer, the Children's Partnership will be selecting 8 individual high school grantees to receive up to $1.5 million over the course of 3 years to support the implementation of or expansion of existing community-specific and culturally responsive peer support programs on their individual campuses. So there are a few different components or elements of this grant opportunity that I'm going to go over. So the first element is the grant application process itself, which I'll get into. The second element is the funding for actual building of a program, for program implementation through support with technical assistance. And then there is a component of participation in a statewide learning community. So all of the grantees that are selected will participate in a statewide learning community with technical providers, with youth mental health advocates, and folks who are really passionate about peer programs and are sort of leading and learning and growing in the peer support space throughout California, and also some of our friends who are not based in California, but are supporting our efforts here in California. And then the last piece is evaluation, because ultimately, as I stated before, the Children's Partnership is an advocacy organization, and we are committed to advocacy and policy change. And our goal with this program is to fight for sustainable funding and sustainable infrastructure for youth-driven peer-to-peer programs in California. So we want to demonstrate positive outcomes. We want to learn best practices from this pilot demonstration and from being in partnership with our ultimate 8 grantees. Okay, so getting into some of the nuts and bolts. So the application will be released on Wednesday, December 13th. That is, I think, 2 weeks from now as of yesterday, which is very exciting. Just thinking about all of the many months that have gone into getting to this point. That's very exciting. So the application will launch on Wednesday, and it will close Friday, March 22nd. And I want to note that the window is intentionally wide. So it's covering the first few months of the spring semester because student engagement in particular and input in the application is critical and required. And we want you as administrators and adult supporters to have adequate time to engage your school community, specifically your young people, in the process. And I'll get into that a little bit more in a moment, but I just wanted to note that. The application will live on, will be linked on the TCP, the Children's Partnership website, but it will live on the Submittable platform. Submittable is a grant making platform that hosts grant applications, and it will allow you to start, save, collaborate with others, and submit your grant application. And all of those details of how to use Submittable, how to set up a profile, all the instructions are very straightforward, and you'll be guided through them when you click the link for the grant to apply. Okay, so let's talk about eligibility. Who is eligible? Any high school serving or eventually serving, right? So if you're a new school and you have just 9th and 10th grade, but will be eventually serving 9th through 12th grades in the state of California is eligible. That's it, period. You have to be an individual high school, not a district. So an entire district cannot apply, and it has to be an individual high school in California. But that's it. Those are the two things that you must be in order to be eligible. And I want to say that this is a pilot demonstration, and we are very committed to representation of our state. So schools across urban, rural, suburban communities who have diverse student populations should feel empowered to apply for this grant. Okay, so the maximum award amount for each grantee will vary based on your specific unique application. So that means like based on your program model that you pick, based on your proposed budget in your application, based on your school population size. So the total minimum award amount over 3 years is expected to be at minimum $450,000, and it's not expected to exceed over $1.5 million. So it's important to note, again, the actual grant awards will vary based on your individual application. And not all grantees will receive the maximum grant amount. This also brings me to the technical assistance component of the grant process. So as part of the grant process, selected grantee recipients will receive technical assistance and support as an allocation as part of their award. So technical assistance partners will partner with grantees to implement their proposed program model, but the technical assistance providers will be contracted, managed, and paid directly from the Children's Partnership, but it will be a part of your grant allocation. Additionally, as part of the grant process, like I stated before, grantees will participate in a learning community that will bring together grantees participating in the pilot demonstration, all the technical assistance providers, national peer-to-peer experts, all of those folks that I named up top, together to participate in a statewide peer-to-peer learning community. Okay, so a preview of what you'll be asked to provide as part of the application. So school narrative, that's things like your school's mission, vision, focus, the barriers and successes of the neighborhood, the community that your school is located in, your level of administrative engagement. There's some really specific questions around administrative engagement, the commitment of the adults at the school is extremely important. And so there are questions related to that so that you can demonstrate that commitment. Student population demographic data. So these are racial, gender, access need data, suspension data, behavior, mental health data, staffing data. We are asking you to provide so that we can have a better understanding of the makeup of your school community. Programmatic narrative. So this is your proposed peer-to-peer program to be implemented at your school site if you're selected as a grantee. So what model, what program are you wanting to implement at your site? And then the budget that goes along with that, right? So this is an estimated budget of your proposed program model. And that's like thinking about things over the course of 3 years, like staffing, right? Like if you want to hire an additional school counselor, school psychologist to help oversee peer counselors, and then also technical assistance, right? If you want to partner with an organization like the Born This Way Foundation or Bring Change to Mind to support with curriculum for a peer-to-peer mental health program, and then operational costs, right? Like the things that go into, running a program at a school site, everything from food costs to marketing materials, etc. And so those are all broken down in the RFA with specific questions and specific line items that we're asking for. But these are the sort of like nuts and bolts of the application. I want to talk a little bit deeper about the programmatic narrative and proposed program model. So I want to be really explicit about this. There are a lot of existing peer support models, and I'm going to share some examples in a moment. And Kelly shared some examples of different models, but within the RFA application, I want to be explicit that we are open to a diverse range of established and innovative peer-to-peer programs. So our goal at the Children's Partnership, and I think that's why this is a unique opportunity that we are the ones who get to oversee this partnership, is to support the type of program that you want to build that meets the needs of your school community and that supports the outcomes that you are interested in addressing. So every school community is unique and faces different challenges and barriers. Every community has unique cultural aspects, sets of values, rituals, right? And we want to support implementing peer support programs that are tailored and responsive to your school community. So that might look like a more structured program, right? That is peer counseling or peer ambassador models that are supported by an adult clinical supervisor that require a deeper level of oversight and training of students. Or it might look like a after school or out of school time mental health club, right? It might look like a mental health club that is helping to destigmatize mental health challenges on campus. It might look like a restorative based program, right? Like maybe your school community is facing challenges around violence and conflict, and you want to focus on bringing in like restorative circle practices and having a youth-led restorative circle practice or judicial council at your school site. These are all models of peer support. And as long as you can convey and think through in your application your program that you're wanting to build, we want to support that. So you don't need to fit into any one size box. Okay. My chat's going off. If you have questions, please put them in the Q&A, just because I can't toggle. And Jen is helping out with the Q&A. So please pop them in the Q&A and we will answer them. Okay, I just want to circle back on this. I touched on it before, but it's really, really important. I want to highlight it again. Student input and involvement in the application process is critical and required. So we believe in young people's power and ability to contribute to finding solutions for the barriers that they face. Frankly, in fact, we wouldn't be here today providing this opportunity if it weren't for the advocacy of California youth who advocated at the state level, went and sat in front of their legislature and advocated for funding for peer programs. And I'm also incredibly proud that our application process has been developed in partnership with amazing young people that range from 15 to 21 who sit on our peer-to-peer advisory council here at TCP. So our work is youth driven and youth voice is really important, and that is a requirement also from whoever we select as our grantees, and it's a requirement as part to be demonstrated as part of the application process. Okay, we're almost through, and then we'll open up for questions. Just have a couple more slides, just reminders of dates. So RFA launches Wednesday, December 13th. I'm pretty sure because all of you are signed up for this webinar, which is awesome, that you'll get like a hooray, the window is open, the RFA is released directly to your email. So that's pretty cool. And the window closes on the 22nd. In between then, if there are questions that are coming up about the application itself, about building out the program narrative, or questions you have around how to think through your budget, or if there are just specific things that you have questions on, we're going to host 2 webinars between when the application is open and when the application is due. And then these are just some application milestones to just think about after you submit your application, just so you understand sort of the different rounds that the applications will go through, and sort of like the dates associated with that, so that you'll be able to track, and you'll be able to track through the submittable platform where your application is, if it's made it to the next round or if it hasn't made it. We're hoping to announce awards on Wednesday, May 22nd. And then we're hoping to enter into individual agreements with the selected grantees in June. So this is sort of a timeline of the process after you submit your grant application. Okay, now's the time. I'm gonna
Hello.
sharing. Hi, and I'm gonna pop on.
So we
Jen.
have quite a few questions.
Great.
So one of the first ones that was asked is, are private schools eligible?
Yes.
Okay. I thought that was a yes, but I figured I would give it to you. And then we've got a question on what is defined as peer. For instance, we run a program that provides peers to students based on shared lived experience, and our peers are recent college grads.
That it would qualify as a peer program. It would need to be same or like within, right? So like the alcove model, for example, high school students can go there, but they have peer supporters who are maybe like college age, like 18 to 22. So that falls within the within the realm of peer.
And then we have, can a district apply on behalf of an individual high school in partnership with that high school?
Yes, I would just say it the other way around. So an individual high school can apply with support from their school district, right? Like we know that in school districts, many times there might be someone who works in an office and oversees, like all mental health programming or grant opportunities. So absolutely, an individual school can call upon the resources of their district, but it is for that school. So if that grantee is selected, 3 high schools within that district cannot spread the money between the 3 high schools. It is for that individual school site. But yes, a district of course can support their school communities with applying for the grant.
Also, you're welcome to type follow-ups if Raven answers your question and it springs a follow-up to mind. This one I believe you answered, but we can circle back to it. Are there predefined program models we are expected to implement?
No. Yeah. Hopefully that was clear. Hopefully, I'm assuming that was probably asked before I went into it, but no, what's really important to us is that it meets the needs and that it's culturally relevant to your school community. Peer support is, in my belief, it can be seen as like indigenous practice, right? So there's all sorts of ways to build a peer support program, and there's not necessarily an existing model. There are best practices and things that we would want to consider with any peer support model, right? Like supervision, right? Peer support is not a replacement for a therapist or a school psychologist, right? So there are things like that we want to think about, but youth mental health like support and clubs and peer support and programs look a variety of different ways.
Okay, I have a clarifying question. The technical assistance and learning community cost comes from the children's partnership, not taken out of the allocated awarded grant money to the site, correct? I'm not sure about that one. I might need further. It's an anonymous question, or I would ask for further clarification.
It's totally fine. Will you say it again, Jen?
Sure. To clarify, the technical assistance and learning community cost comes from the children's partnership, not taken out of the allocated award grant money to the site, correct?
Not correct. So say you want to, this is just an example, but say you want to partner with Bring Change to Mind, and I'm just using them. This is not, none of the things that I'm about to say are facts about Bring Change to Mind, but say you're wanting to partner with them and utilize their curriculum, and say that they have an associated cost that goes with utilizing their curriculum, that goes with partnering with them for them coming to your school campus and facilitating. That should be part of your thought process of your budget, and then your total grant will be reflective of that that technical assistance as part of the budget, the money for the actual technical assistance provider. So then if you're selected as a grantee, we will match you, bring you together with the right technical assistance provider. And if you have folks, community-based organizations that you work with or that you want to work with, that you're excited about, like, you should talk about them, list them in your grant application, but we will then engage them and contract them, and the money will just come directly. We will manage that part of the process of paying that technical assistance provider, but it will be reflected as part of the overall grant money that you receive. Hopefully that answers the question.
Feel free to write a follow-up question. I'm tracking these if you need further explanation. This is a
also, I'm gonna give our contact information after this. So also, if you want to get really specific, or if you want me to break it down even further, and maybe like now is not the time, you can always feel free to email me, or we can jump on a call. I'm happy to talk to anybody about the different elements of the application.
These next two questions are pretty similar. Can a community-based organization be the primary applicant if they are working with a high school?
No, that's a great question. I'm so happy whoever asked. No, but if you are a community-based organization and you're working directly with a high school, you should support that high school in applying for this grant opportunity and listing you and your program to be the technical assistance provider. So you can work with that individual high school for them to apply, but community-based organizations themselves cannot apply. You must be a high school located in California. But that's a great question.
And then this is slightly different. Can a school use the funds to subcontract a nonprofit to provide support?
That's I think covered on what I'm saying. So we will subcontract for you. We will oversee, but you can allocate your funds to that. Yes.
Okay, this one's different. Must the involved youth only provide peer-to-peer support to others at their school, or might they serve their community or a broader audience?
That's a great question. I am not going to say no. I would want to know more and like understand and read the narrative of the program. So if it's a program where they're supporting folks at their school site, but they're also doing community outreach or providing resources to the community around destigmatizing mental health or whatever it might be, that to me makes total sense and sounds like peer support program. So yes, asterisk, I would say.
And then we haven't been asked this one. Is there a sense of what the learning community involvement will entail? Will there be monthly meetings or weekly meetings? What are you expecting it to look like?
It's a great question. Right, it's not fully built out, but what we are talking about right now is quarterly opportunities, at least quarterly virtual opportunities that everyone would come together. And then I would love to see an annual in-person convening. But the learning community will consist of an online platform that everyone has access to, that you can upload resources to, ask questions to, share best practices, share challenges across the learning community. And then there will be at least quarterly convenings. And once we get to the June MOU process of coming into partnership together, those more concrete expectations around the learning community will be outlined in the MOU.
Okay, I feel like this is a pretty similar question. Can a county office of education apply for one of their high schools?
No. The individual high school needs to apply. And what I what comes to mind also is the commitment of the school site is really important. Jen is an educator. She knows, she just left a school for 8 years. I have worked with schools for 12 years, worked in schools for 12 years. Like, it is, we know the amount of priorities and the amount of things that are on school administrators' plates. And also, we know that that sometimes leads to going into partnerships where there's not enough capacity. And so demonstrated prioritizing of this partnership and of the peer-to-peer program is really important. And it's important that it's demonstrated by the folks at that school site. So again, a county office can 100% support in the application process, but it needs to be the individual school site who is applying, engaging their school community, engaging their students, and completing the application process.
Okay, this one is about community organizations. If a community organization is the technical assistance provider, can they conduct the interviews and draft the application for the school to submit? So it's a community organization wants to help the school submit.
The school needs to submit. If there's already folks who already work with the school site and they want to be part of the process and they want to help, like, they can totally help as part of the school community. But the driver, the submitter of the application needs to be someone from the school site.
We're down to the last couple. Is there a possibility that you will award to more than 8 high schools if the schools do not reach the 8 million budget?
No.
And then is there any conflict? Is it a community, if it's a community school?
A community school, as in a school ran by like a Office of Education. No, no asterisk. If you're the person who wrote that question, I encourage you to email me separately and we can talk more in depth. But my understanding of a community school, no, there's no conflict that community school should be able to apply.
They followed up with, we were awarded a community school grant by the state of California.
That's okay. It's
go ahead.
No, that's okay.
And then is backup documentation for reporting going to be required?
As part of when we enter into partnership, as part of the MOU process, there will be set criteria of the type of documentation that we will ask for on a regular basis. So yes, asterisk.
I don't have any more questions in the Q&A. I'm going to scroll over the chat and see if there's, we do have one. Given such a large budget for one site, what are thoughts or expectations for sustainability and scaling to other sites beyond the demonstration project?
That's a great question. And what I'll say is that it's a 3-year-long partnership. So part of our work is to think about, during the partnership, sustainability and building out an infrastructure. What will the pilot demonstration look like beyond the 3 years? We are already sort of like thinking about that question and wanting to be in partnership with the grantees and bringing folks together in the learning community to think about how do we advocate and ensure that there is sustainability for these programs that are implemented. So I don't have the exact answer to that, but that is core to the pilot demonstration process, is to think about long-term sustainability, expansion, growth. What does this look like? Can districts duplicate this? where would the money come from the state? And Angela Davis, our mental health policy director, does a lot of work on the policy side around this. So she will also be involved in helping to think about what does long-term sustainability look like. That's a great question.
We have another question about the deadlines. Can you redisplay the deadlines?
Thanks, Angela, for saying that. Yeah, we would not pick 8 school sites. There must be 8 school sites. So thanks, Angela. I'm happy that you're here in the chat. Okay, the deadlines. Let me repeat them. So December 13th, the application launches. March 22nd, the application closes. So those are the 2 major deadlines. In January and in February, there'll be 2 opportunities to come and ask questions. Although if you're engaged in the process, you'll be able to ask me questions whenever one comes up. But those are the 2 important deadlines. Launches December 13th, closes March 22nd. Any other questions, Jen?
There are no other questions in the Q&A. We do have a note from Angela. I wasn't sure if you wanted to address.
Oh, that's a good point, Angela. Let's look into that because I'm not sure. But if that instance comes up, we can approach it on an individual basis. But I will, oh, cool. But yeah, I'll look into that. But that's a good one. Sorry. Okay. Thanks, Jen, for manning the Q&A. Thank you, everyone who has attended our webinar, and all of the community-based organizations also who are present, who are connected to school sites and wanting to be involved and advocate. If you are a community-based organization that I'm not in contact with already, please reach out to me. Would love to meet you, to be in community with you, to get to know more about your work and what you offer, and if you might be a good fit as a technical assistance provider for a grantee. I'm going to share my screen again just so I can show you my contact information. There we go. So yeah, you can reach out to me, rjones@childrenspartnership.org. If you go to our website, I'm also there. Jen is also there. Angela is also there. And we're happy to talk with you, to connect with you, and to support you through this application process. And if any other needs or questions come up, please reach out to us. And thank you so much for joining today. And thank you, Kelly, and thank you, Jen, and thank you, Monique, for your support. And we'll see you all next time.